My name is Impasoli Pava, and today I want to talk more about infertility. So I have joined by a guest who will give us more insights about infertility. So I welcome you and I beg you to introduce yourself.
And my name is Daliso Muluwaza.
Okay, fine. So let's talk about infertility. When we talk about infertility, what is it?
Infertility is when a male or a female cannot conceive due to a problem with the reproductive system of either partner. Infertility can be trusted source, primary or secondary. When you say primary fertility is when someone is not able to conceive at all. Secondary fertility is when someone has previously conceived but is not longer able to. This article explains infertility causes, types and treatment, as well as other things a person may wish to know about infertility in both sexes.
Okay, what are the causes of infertility?
Infertility is defined as the inability to get pregnant after 12 months of trying. And a person of either sex who fits this definition is experiencing infertility. The following are the causes of infertility in males. Problems with semen and sperms is the first cause in males. Semen is a milky fluid that penis releases during ejaculation and consists of fluid and sperms. The fluid comes from the prostate gland, the seminal vesicles, and the sex glands. The sperm is produced in the testicles. When the ejaculate comes out of the penis, semen helps transport the sperms towards the egg. This makes things that can make it trusted source more difficult for sperm to fertilize the egg include having sperm count below 15 million, low sperm mortality, or sperm that have an unusual shape and harder time fertilizing the egg. About 2% trusted source of male may have these types of issues, which their sperm they can result from. Another one is medical condition. This condition could be the testicular infection, cancer, or surgery. Furthermore, overheated testicles. Causes include undescended testicle, a varicose, then in the scrotum. The use of saunas or hot tubs, wearing tight clothes, and working in the environments. Ejaculation disorders is also caused in males. If the ejaculatory ducts are blocked, semen may be ejaculated into the bladder. Next of that is abdominal imbalance. Hypogonadism, for example, can lead to testosterone deficiency.
Okay, you have discussed about general causes of infertility.
Yes.
So, what are the causes of infertility in males?
There is a genetic factor. A male should have X and Y chromosome. If a person has two X chromosome and Y chromosome, as in Klinefelter syndrome, the testicles will develop abnormally, and there will be low testosterone and low sperm count or no sperm. Another one is MAPS. If this occurs after puberty, inflammation of testicles may affect sperm production. Hypopadiasis. With this congestion anomaly, the urethra opening is under the penis instead of at its tip. Doctors usually surgically correct this condition during infancy. If the correction is not done, it may be harder for the sperm to reach the female's cervix. Hypostasis affects about 1 in every 200 newborn boys tested source in the United States. Cystic fibrosis. This is a chronic disease that results in the creation of sticky mucus. This mucus mainly affects the lungs, but males may also have an absence that's difference. The first difference carries sperm from the epidermis to the ejaculate duct and the urethra. Radiation therapy or chemotherapy. This treatment can both impair sperm production. In the case of radiation therapy, the severity usually depends on how near to be testicles and radiation occurred. Other diseases conditions that sometimes linked to low fertility in males are anemia, Cushing syndrome, diabetes, and thyroid diseases. Medication. Some medications increase the risk of fertility problems in males. These include sulfasalazine and anaerobic steroids.
Okay, what is the other causes?
And the other causes are problems with ovulation. Ovulation disorders make about 25% trusted source of infertility causes in females. Ovulation in the monthly release an egg. The egg may neither be released or they may only released in some cycles. Ovulation disorders can occur due to hyperprolactemia. If prolactin levels are high and females is not pregnant or breastfeeding, it may affect ovulation and fertility. Thyroid problems. An overactive and underactive thyroid glands can lead to hormonal imbalance and the interference with ovulation. Polycystic ovary syndrome. This is a hormone condition that can cause frequent or prolonged menstruation and can interfere with ovulation. Problems in uterus or fallopian tubes can also prevent the egg from traveling from ovary to uterus. If the egg does not travel, it can be harder to conceive naturally. And the other causes include chronic conditions. These include AIDS or cancer. Primary ovarian insufficiency. The ovaries stop working normally before the age of 40 years. Poor egg quality. The quality of the egg may interfere with conception. As the female ages, the number and quality of eggs declines. Eggs that are damaged or develop genetic abnormalities may also be able to sustain a pregnancy. The older a female is, the higher the risk. Surgery. Pelvic surgery can sometimes cause scarring or damage to the fallopian tube. Cervical surgery can sometimes cause scarring or shortening of the cervix. The cervix is the neck of the uterus. Submucosal fibroids. Benign or non-cancerous tumors occur in the muscular wall of the uterus. They can interfere with the implantation or block trusted source, the fallopian tube, preventing sperm from fertilizing the egg. Endometrius. Cells that normally occur within the lining of the uterus start growing elsewhere in the body. Tubal ligation. In females who have chosen to have their fallopian tube blocked, the process can revised, but the chances of becoming fertile again are not high.
Okay, what are the risk factors of infertility?
There are certain risk factors that can increase the chance of fertility for both sexes, and these include smoking. Smoking significantly increases the trusted source of risk infertility in both sexes, and it may undermine the effects of fertility treatment. Smoking during pregnancy increases the chance of pregnancy loss. Passing smoking has also been linked to lower fertility. Chemotherapy. Some chemotherapy drugs can result in ovarian failure or significantly reduce sperm count. Radiation. If this is aimed near the reproductive organs, it can increase the risk of fertility problems. Sexually transmitted infections. Chlamydia can damage the fallopian tube in the female and cause inflammation in male scrotum. Some other STIs may also cause infertility. Age. The female's ability to conceive may start to fall gradually before or around the age of 35 years, trusted source, while male infertility starts to fall after the age of 40 years, trusted source. In addition, other factors may also be associated with infertility, although in many cases the research is still insufficient, and these include narcotics. Consumption of drugs such as cannabis or cocaine can lower the sperm count. Some females who use cannabis or cocaine may also have infertility problems. Exposure to certain chemicals. Some pesticides, herbicides, metals, detergents, and solvents have been linked to trusted source to infertility problems in both sexes. Obesity. This may reduce the trusted source the chance of conceiving for both sexes. Stress. Stress can be a factor, especially if it leads to reduced sexual activity. It can also affect female ovulation and male sperm production. Exercise. Too much and too little exercise can lead the trusted source to infertility problem in both sexes. In males, it can affect trusted source the sperm count. Nutrition. An unhealthy diet can trusted source impact fertility in male trusted source and females. If the eating disorder leads to serious weight loss, fertility problems may also arise. Alcohol misuse. Excessive alcohol consumption may reduce the trusted source sperm count. It may also trusted source interfere with the course of vitro fertilization treatments.
Okay, what treatment is available for infertility?
Treatment, it helps a person conceive naturally, will depend on many factors, including the age of a person who wishes to conceive, how long fertility has lasted, personal preferences, and their general state of birth. Frequency and of intercourse. The first strategy of couple trying to conceive may wish to try to having sexual intercourse more often around the time of ovulation. Typically, the menstrual cycle lasts about 28 to 32 days, counting from the first day of the last period. A female will usually ovulate anywhere between day 11 and day 21. A person whose cycle is shorter than 21 days or longer than 35 days should see their doctor for ovulation. Learn more about how to calculate an ovulation cycle. Other treatments, however, timing intercourse may not be sufficient on its own. It help a couple conceive. Treatment will depend on the underlying cause of fertility. In males, this can include trusted source medications of erectile dysfunction. Surgery may include procedure to remove a varicose vein in the scrotum or repair broken epidermis. In females, doctors can prescribe fertility drug to regulate or induce ovulation. This can include clomiphene, letrozole, dopamine, agonist medications, and a variety of hormonal drugs. Learn more about fertility drugs for females. If the fallopian tubes are blocked or scarred, surgical repair may make it easier for eggs to pass through a person. A person may also be advised to undergo IVF. Doctors may also treat endometriosis with laparoscopic surgery. They may a small incision in the abdomen and insert in a thin, flexible microscope with a light at the end, called parascope. The surgeon can then remove implants and scar tissues with which may reduce pain and aid fertility.
Okay, what are the methods that are currently available for assisted or artificial conception?
The one is intrauterine insemination.
Yeah.
At the time of ovulation, the doctor inserts a fine catheter through the cervix into the uterus place and sperm sample directly into the uterus. In vitro fertilization, doctors place sperm with an fertilized egg in a petri dish where the fertilization can take place. They then place the embryo in the uterus to begin pregnancy. IVF techniques can include intracytoplasmic sperm injection and assisted hatching, sperm or egg donation. If necessary, a person can use egg or sperm donation. Fertility with donor egg can be done using IVF, electric or vibratory stimulation to achieve ejaculation. It may be possible to a person achieve ejaculation with electric or vibratory stimulation. This can help a male who can ejaculate normally, for example, become a spinal cord injury. Surgical sperm aspiration. The sperm is removed the trusted source from a part of the male reproductive tract as the vas deferens, testicles, or epidermis. Doctors will use IVF to fertilize the egg or freeze the sperm for later use.
Okay, how is the infertility diagnosed?
A person may want to visit a physician if there is no pregnancy after 12 months of trying. If the female partner is over age of 35 years trusted source, the couple may wish to see a doctor earlier, as fertility testing can take time. For example, a person over 35 years may want trusted source to see a doctor after 6 months, while a person over 40 years may want to see a doctor as soon as they realize they are not becoming pregnant. A doctor can give advice and carry out some preliminary assessment. The doctor may ask about a person's sexual habits and make recommendations regarding this. Tests are available, but the testing done does not always reveal a specific cause.
Okay, how infertility is tested for males?
The doctor will ask about medical history, medications, and sexual habits and perform a physical examination. If a test shows an abnormality, the doctor may recommend an examination of testicles for lumps or deformities and an exam of the shape and the structure of penis. In addition, the doctor may order trusted source the following tests. Semen analysis. A sample may be taken to a test for a semen concentration, motility, color, and quality, as well as the presence of blood or infection. Sperm counts can fluctuate. Several samples may be necessary. Another one is blood test. The lab will take the levels of testosterone and other hormones. Ultrasound. This may reveal issues such as ejaculatory duct obstruction or retrograde ejaculation. Chlamydia test. Chlamydia can affect fertility, but antibodies can treat it. However, antibodies cannot cure trusted source any existing damage to fertility.
Okay, you have discussed about how infertility is tested for males, and what about in females?
In females, a female will undergo a general physical examination and a doctor will ask about medical history, medications, menstruation cycle, and sexual habit. They will also undergo gynecological examination and a number of tests. Blood test. This can assess hormone levels and whether a female is ovulating. Hysterosalpinography. A technician injects fluid into a uterus and takes X-ray to determine whether the fluid travels properly out of the uterus and into the fallopian tubes. If a blockage is present, surgery may be necessary. laparoscopy. A thin, flexible tube with a camera at the end is inserted into the abdomen and the pelvis, allowing a doctor to look at the fallopian tube, uterus, and ovaries. This can reveal signs of endometriosis, scaling blockages, and some irregularities in the uterus and fallopian tubes.
Okay, what are the other tests for infertility?
Other tests for infertility, there are ovaries review testing to count the eggs after ovulation, pelvic ultrasound to reduce an image of uterus and ovaries, thyroid function tests, this may affect the hormonal balance.
Okay, what is the outlook for infertility?
The outlook for infertility, for couples who experience fertility problems and those who wish to have children at an older age, there are more options available than either before. In 1978, the first baby was born as a result of IVF. Today, about 2.1% trusted source of all infants born in the United States annually are conceived via some form of assisted reproductive technology. As new technology become available, fertility treatment is now accessible to more people, and the success rates and the safety are improving at all times. Financing fertility treatment can also be costly, but there are programs that can help with this.
Okay, how common is infertility?
Worldwide, 8 to 12% trusted source of couple experiencing fertility problems. At least 20% trusted source of infertility cases happen solely due to problems with the male reproductive system. In addition, 19% trusted source American females ages of 15 to 49 years experiencing primary fertility. After 1 year, trying about 6% married females ages 15 to 49 years experience secondary fertility. Black Americans and the Latinx females are more likely to have infertility compared with American females who are white.
Okay, what are some complications of infertility?
The complications of fertility, if conception does not occur, it can lead to stress and possibly depression. Some physical effects may also result from treatment for infertility. For example, a female could get trusted source ovarian hyperstimulation syndrome from taking medication to stimulate the ovary. Another complication can be ectopic pregnancy. Multiple pregnancy may also result from fertility treatment. If there are too many embryos carrying all of them, the tail may cause health problems during the pregnancy.
Okay, this is the end of our discussion for today. So I thank you so much.
Yeah, thank you very much.